Welcome to Usmle World, where we ask, answer, and explain Usmle questions. Today, we're diving into Step 2, Surgery, focusing on the general surgery. Let's get started with question number 1. For the following case, which of the following is the most appropriate next step in management of this patient? A. Bariatric surgery referral. B. Further reduction of caloric intake. C. Low carbohydrate diet. D. Phentermine for appetite suppression. E. Strict 60 minutes of daily aerobic exercise. The case scenario is: a 42-year-old woman comes to the office for a follow-up visit. She has been following a weight loss program with dietary modification and exercise for the past several months. The patient weighs 110 kg and her height is 170 cm. Also, her BMI is 38. In the last 6 months, she has lost 3% of her initial body weight on a balanced and low-calorie diet of 800 kilocalories per day. The patient has been strictly adhering to dietary recommendations and exercising as much as possible, but feels she is not making progress. She also reports feeling hungry all of the time. The patient says she is motivated to lose weight but is starting to feel discouraged by her results. Medical history includes hypertension, type 2 diabetes mellitus, and obstructive sleep apnea. Blood pressure is 140/80 and pulse rate is 78 beats per minute. Physical examination shows an obese habitus but is otherwise normal. The question is: which of the following is the most appropriate next step in management of this patient? Your options are: A. Bariatric surgery referral. B. Further reduction of caloric intake. C. Low carbohydrate diet. D. Phentermine for appetite suppression. E. Strict 60 minutes of daily aerobic exercise. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is A, which is bariatric surgery referral. This question is designed with the focus to assess your ability to implement mixed management. This patient has obesity and multiple weight-related comorbidities, including type 2 diabetes mellitus, hypertension, and obstructive sleep apnea. Her weight has failed to improve despite appropriate dietary modifications and exercise. Therefore, medical weight loss intervention is indicated. Appropriate options include weight loss medication and referral for bariatric surgery. Weight loss medication is indicated for patients with a BMI of greater than or equal to 30 kg per meter square, which are obese, and those with a BMI of 25 to 29.9, which are overweight, and with weight-related complications. Primary options include orlistat, lorcaserin, naltrexone bupropion, phentermine topiramate, and liraglutide. The choice of drug is individualized based on comorbidities, concurrent medications, and side effect profile. Weight loss or bariatric surgery is indicated for patients with a BMI of greater than or equal to 40 kg per square meter and those with a BMI greater than or equal to 35 and additional weight-related comorbidity. Although non-surgical interventions are often attempted first, medication failure is not required to qualify for weight loss surgery, and both interventions may be pursued concurrently, with medication prescribed while the patient is undergoing preoperative evaluation. If you choose any option other than A, you are wrong. Let's briefly discuss the other options. Choice B cannot be the answer because moderate caloric restriction, like 1500 to 2000 kilocalories per day, is usually adequate for producing weight loss in obese patients. A caloric restriction of 800-1500 is generally considered the most aggressive diet that can be sustained. Very low-calorie diets, of less than 800 kilocalories per day, have a high failure rate and usually do not yield greater long-term success than conventional diets. Choice C cannot be the answer because weight loss diets with various macronutrient contents, example, low-fat, low-carbohydrate balanced, have been advocated, but the ideal diet appears to be determined by individual factors and preferences. This patient has already tried a fairly aggressive diet. Changing the macronutrient content may make a small difference but is unlikely to provide significant, sustained weight loss. Choice D, sympathomimetic weight loss medications, like phentermine monotherapy, are usually avoided because although they can induce short-term weight loss, they are associated with extensive regain and minimal long-term benefit. Choice E cannot be the answer because exercise should be included in any comprehensive program to enhance weight loss, reduce regain, and improve overall well-being. However, exercise alone does not typically lead to significant loss and is unlikely to help this patient achieve her goal. Your take-home message from this question is that Bariatric surgery is indicated for patients with a BMI greater than or equal to 40 kg per square meter or those with a BMI greater than or equal to 35 and additional weight-related comorbidity. Weight loss medication is indicated for patients with a BMI greater than or equal to 30 kg per square meter or those with a BMI 25 to 29.9 and weight-related complications. Medication failure is not required for patients to qualify for bariatric surgery. Both interventions may be pursued concurrently. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.